My name's Christy, and I'm going to be your nurse practitioner student today. Can you tell me what your name and birthday is?
Ashley Krautheim, 7/31/88.
And what do you prefer I call you?
Ashley.
Okay, Ashley, what brings you into today?
I'm just here for a wellness checkup.
Okay, no complaints about anything today?
No.
Okay, so what we're going to do is I'm just going to ask you questions about your current and past medical history, surgical history, a bunch of social questions, and then we'll just review any symptoms that you might be having throughout any of your body systems. First question here is, do you have any past medical history?
I do. So I have glaucoma, I have irregular menstrual cycles, and acid reflux.
Okay. Any surgical history?
I have had laser eye surgery for my glaucoma.
On one eye or both eyes?
Both eyes.
Both eyes. Have you ever been hospitalized overnight?
I have.
What were you hospitalized for?
Acid reflux.
Okay. And how long ago was that?
15 years ago.
Okay. Are you up to date on your vaccinations?
I am.
Do you take any medications on a daily basis?
I do.
What do you take?
I take my birth control, Pemtrera, a acid reflux medicine, Pantoprazole,
Pantoprazole.
yeah.
Okay.
I take vitamin D, vitamin C, multivitamin, elderberry, and Zyrtec.
Okay. And you just have seasonal allergies? That's what
Correct.
you take the Zyrtec for? Okay. What about your family? Mom's still alive?
Yes.
And how old is she?
63.
Does she have any past medical history?
She does. She has diabetes.
Diabetes, anything else?
I don't think so.
Okay. What about Dad?
He is deceased
When did he die?
when he was 49.
And what from?
Cirrhosis.
Was he an alcoholic?
No.
Okay. Any other medical history for him?
He had Crohn's disease and I don't think so.
Okay. Any siblings?
I have a sister,
And she's how old?
32.
And does she have any medical
No.
history that you know of? Okay. What about grandparents?
I have living. I have grandma on my mom's side. She has diabetes. She also has vision issues with macular degeneration.
Okay.
And then I have a grandfather that's deceased, and he was 93 when he died. I don't remember what he died of kidney failure, I think.
Okay.
And then on my dad's side, I have a mother who was deceased. I don't know when she died. She also died of Crohn's disease, non-alcoholic. And
I'm sorry, Crohn's or
or
cirrhosis?
not Crohn's, cirrhosis.
Okay.
Sorry. And then I have my paternal grandfather who died of emphysema at 81.
Okay. Who do you live with?
I live with my mom.
Is it one story or two?
Two.
Okay. And what do you do for work?
I work at Akron Children's as a recruiter in HR.
Did you go to college?
I did.
What do you have?
I have a bachelor's degree.
Okay, great. You work full time?
Yep.
Any children?
Nope.
How much caffeine do you think you drink a day?
1 cup. I have 1 espresso a day.
Okay. Any alcohol?
I mean, 2 to 3 glasses maybe a week.
Okay. Smoke cigarettes?
No.
Any drug use?
No.
Do you exercise?
No.
And any religious preferences?
I mean, I'm a Christian.
Okay. So that is pretty much all of your history. We'll just go through and ask questions about anything else that might be going on. You said that you had glaucoma?
Yep.
So you see an ophthalmologist?
Every 6 months.
Every 6 months. Do you wear glasses?
I do not.
Okay. Any double vision, blurred vision?
No.
Eye pain? Nothing like
Nope.
that? Any earaches?
No.
Nasal drainage? Sore throat?
No.
No. What about any cough?
I do have a consistent cough right now.
Consistent cough. Have you seen anybody for that?
I did a telehealth appointment and got an antibiotic, and I'm taking the pearls and over-the-counter Tylenol and nose spray.
Okay. Any improvement, or has it gotten worse?
It got worse, but now hopefully it'll get better.
Okay. Are you short of breath at all?
No.
Any chest pain?
No.
Any fevers or chills?
No.
You said no chest pain. Do you have any cardiac history?
No.
Ever had any cardiac testing done?
No.
Any leg swelling?
No.
Okay. You mentioned that you had the acid reflux. Is that pretty well under control right now
Correct.
with the pantoprazole? Are you having any symptoms today?
No.
Okay. Normal bowel movements?
Yep.
How often do you go?
1 to 2 times a day.
Okay. Ever had any endoscopies, EGD, colonoscopy, anything
No.
like that? Any urinary problems? Burning with urination,
No.
frequency? You feel like you go enough?
Yes.
You drink enough water? Ever had any UTIs?
Once when I was in high school.
Okay. And you're not diabetic?
No.
Okay. Any rashes, any new moles, any concerns?
Nope.
There. Any joint pain?
Nope.
No muscle aches?
Nope.
Have you ever broken a bone in the past?
I've not broken a bone, but I've had consistent ankle sprains.
Ankle sprains, and do you see an orthopedic doctor or anything like that for
I
it?
don't.
Okay. You said that you have had 1 UTI. Any sexually transmitted infections?
No.
And you mentioned that you had the heavy bleeding. Do you see a gynecologist for that?
Yep.
Are they giving you any treatment?
Just the birth
The
control.
birth control. Have they done any testing? Any ultrasounds?
They did do testing a long time ago to see if I had fibroids, but that was negative.
Okay. Okay. And when was your last menstrual cycle?
Currently.
Okay. Are you sexually active?
No.
Okay. Are your periods painful?
No.
No. Just heavy. Any dizziness or lightheadedness?
No.
No history of seizures?
Nope.
You don't have any tremors? Headaches? Any recent headaches? I
Not
know you said you
recent.
had a history of migraines, but
Yep.
those are pretty well controlled too?
Yep.
Okay. Have you ever seen a neurologist?
No.
Or any neurological testing?
No.
Okay. Any abnormal bruising?
No.
Have you ever been told that you were anemic?
No.
With the menstrual bleeding? No. You're not on any iron supplements other than
Nope.
the multivitamin? And have you ever required a blood transfusion?
No.
Okay. Last thing, do you have any thoughts of harming yourself?
No.
Any history of depression or anxiety?
No.
Any concerns about any like panic attacks?
No.
You have a good support system? Do
Yes.
you sleep okay at night?
Yep.
Okay. Do you have any questions for me?
I don't think so.
Anything else that you'd like to add?
Nope.
Okay, great.